All right, we're going to go ahead and get started. Good afternoon, everyone. Thank you so much for joining us today. My name is Leah Paley, and I am the CEO of the Anne Arundel County Food Bank. I wanted to take a moment to say thank you to not only our panelists who have agreed to join us today for our conversation, but also to each of you for joining us for this informative discussion on the topic of food insecurity and nutrition. I just have a few housekeeping announcements before we get started. Just a reminder that this event will be recorded. It's also being live streamed on Facebook. We ask that you please keep yourself on mute. If you do have any questions for our panelists, you can enter them into the chat box. We have reserved about 10 to 15 minutes at the end of the event to answer any questions you might have. So you're here today because we're kicking off Nutrition Month. What is Nutrition Month? Well, for us, it's an important month-long awareness campaign, and it's an opportunity to not only work with our partners who provide nutrition education to our community members, but also a chance for us to highlight how our partners throughout the county are working together to fight food insecurity, while also providing nutritious food for people who need it. I'm going to go ahead and ask each of our panelists to introduce themselves. For our panelists, if you can please give us an overview of your professional background, and in the spirit of Nutrition Month, let us know what your favorite vegetable is. Dr. Pam Brown from the Anne Arundel County Partnership for Children, Youth, and Families, we're going to go ahead and get started with you.
There we go. Hi, everybody. Good morning and good afternoon all at the same time. It's lunchtime. I have a rather eclectic career. I've been in human services my entire career. I've worked in 2 countries, 2 states. I've worked for the state, for counties, and for 2 cities. And I've also worked for a not-for-profit, but always trying to be as helpful as I can to those who are most vulnerable in our communities.
Thank you, Pam. And what's your favorite vegetable?
Oh gosh, how could I forget that
the
one?
Most important part.
I love all veg, but my favorite is cauliflower, especially with cheese sauce on it.
Sounds good. All right, thank you, Pam. All right, next up is Dr. Nilesh Kalyanaraman, who is with the Anne Arundel County Department of Health.
Thank you, Leah. Thank you, everybody. It's good to see all of you. I am the health officer at the Anne Arundel County Department of Health, and I am an internist, primary care doctor by training. Spent pretty much all of my career in caring for the underserved for the past 2.5 years at the health department, and then for about 13 years prior to that in community health centers, both in Baltimore and in Washington, D.C. And so this work that we're talking about today is near and dear to my heart. My favorite vegetable, I never answer one, so I'm going to give you 2. Carrots and chayote squash.
Oh, I have not heard of the latter. What's that?
You know, I don't know. I grew up eating it, and we can never find it in stores. And now it's like in the Giant and everywhere, and it is slightly sweet. It's its own thing. I'm proselytizing.
Okay, I'll look for it the next time I go. All right, awesome. Thank you, Dr. K. All right, Karrisa Kelly, who is with the Anne Arundel County Department of Aging and Disabilities, last but not least.
Thank you very much. I'll lead with my favorite vegetable. It's spinach. It's the superfood. You can't get any better than that. So yes, I'm Karrisa Kelly, the Department of Aging and Disabilities Director. I've had the honor and privilege for the past 27 plus years to be able to serve the most important population to me, which are older adults and individuals with disabilities. I've worked in both public and private sectors across an array of settings, from residential, long-term care, school systems, healthcare, anything that touches the population that I serve. We operate at my department 23 programs in 22 locations. And one very special program that we have is our senior nutrition program, which is celebrating its 50th anniversary as well. So this is also near and dear to my heart, and thank you for including me on this important topic.
Well, thank you to each and every one of you. We definitely have some experts on this call, and I'm really, really excited to just dig in and ask you some questions. So let's go ahead and get started. The first question I have is for Nilesh. If you can give us an overview of how well our county, Anne Arundel County, is doing in terms of nutrition and how we stack up against the rest of the state.
Sure. So we look at this in a few different ways. So one of the things we look at is obesity. About 33% of the adults in the county are obese, but I think more concerningly is 17% of the kids in this county are obese. And I think the folks on this webinar are familiar with some of those drivers, but I think one of the key things to understand is that obesity is quite tightly linked with poverty, and has to do with the types of foods that are available for people. 13% of folks in the county live in areas with poor access to healthy food in the county. And then over the past couple of years, we've seen food insecurity rise from about 9% to about 10.7%. Overall, compared to other counties in the state, we're pretty much average. And so I think that means that there's room for us to do better by the residents here in the county, and particularly, seeing what's happened with COVID, and I know we're going to talk more about that. Really, that's an opportunity to take that spotlight on those issues that COVID has shown and to keep it there and work on those issues.
Great, thank you for that intro and great information. Pam, I'm curious to know, what are the most common nutrition-related problems experienced by the population that your department serves?
We, as I think many of you know, are very, very focused on very low income families and children. They tend to be disproportionately African American and Hispanic. And so a lot of the issues we see are, yes, to do with food, but it really, for those families, access to everything is an issue. So access to healthcare, access to good housing, access to parks and recreation. So for our families, when we are seeing the impact of food, we're also seeing the impact of a whole set of other things. And let me just say that 75,000 people in Anne Arundel County live in what we call a food desert, where there's very little access to healthy food. And the sorts of things you see, especially in children, hungry children, are low achievement in the school system, health issues, anything from asthma through immune issues, and then behavior issues that come from hungry children, aggression, sleepiness in the school system, lack of good social skills. All of that through research has been attached to food. But I would say that there are a whole set of other things going on for those children besides the fact that they're not receiving healthy food, including some of the environmental issues that I've talked about. So for me, food is part of a package of things that we really need to address as we think about raising all of our children to be ready for school. We know, for instance, that hungry children are less likely to be ready for school socially and in terms of achievement. So those 0 to 5 years, when other children are getting excellent nutrition, wonderful places to play, lots of opportunities in preschool, the children and families that we serve do not have that level of access. I think that's about it in terms of what we see.
Great, thank you, Pam. Very, very thorough response. I appreciate your insights there. Karrisa, I'm thinking that older adults, people with disabilities, might face some of these nutrition-related problems. Are there others that are common amongst the population that you serve?
Yeah, so, as adults age, they tend to eat fewer calories, and that results in deficiencies in their ability to get adequate nutrition, vitamins, minerals, and those deficiencies then likely tie into chronic conditions such as heart disease, diabetes, cancer, osteoporosis. So they're just eating less and able to get less of those vitamins and minerals. In addition to that, older adults are on an increased number of medications. And those, some of those medications decrease the body's ability to absorb nutrition for those older adults.
Huh. Very, very interesting, and some things that I was not aware of. So I appreciate you providing some of those insights. I do have an additional question for you, Karrisa. If you can talk a little bit about the biggest barriers, and I think you kind of alluded to that on some level, but maybe dig in a little, biggest barriers to adequate nutrition that are faced by the population that you serve. And if you can also add how that impacts their ability to thrive.
Sure. So I think, across our population in any age group, it's access to food and access to healthy options, as Pam was saying. This is even more so for older adults. Transportation is a barrier. We have fewer and fewer older adults that are able to drive. So they may be dependent on a family caregiver or a fixed route transportation in order to get access to a grocery store. I don't know if you've ever taken a bus to a grocery store, loaded up your cart, and then realized you can't carry it all on. Access to that transportation and then only being able to carry a few bags on, a transportation venue. Also, mobility needs. If you're dependent on a walker or a wheelchair for mobility, you're less able to navigate some of these locations. In looking at areas where, in the southern parts of the county and northern parts of the county, where there's just not enough grocery stores within distance, this makes it especially difficult for older adults to get to those places as well. Also, I would say, I'm experiencing this right now, as I used to have to plan meals for a family of 6. So as you get older and your children start leaving, and you may or may not have your spouse around, you're looking at planning a meal for maybe 1 or 2 people. It's very easy to say, should I cook these, vegetables and lean meats and prepare this large meal that might go bad? And it's easier for me to go through a drive-through and maybe make a less healthy choice. And I know that there's some new options of, food delivery and planning portion control meals for a couple people, and that's been helpful. Also, income, as Pam had said, also affects older adults. They're likely no longer working. They're, maybe dependent on a small pension, Social Security. So they're on a fixed income. So it's difficult. We know that healthy food choices are expensive. It's easier to buy a 99-cent, burger from McDonald's than it is to go out there and buy, a bunch of asparagus for $5. And that's been increasing, throughout the pandemic for all of us. And then I would say, as you age, you're more likely to develop conditions where you are more dependent on medically tailored meals. So having those options accessible out there.
It really seems like, especially for older adults who are low income, that on many levels the cards are stacked against them. There's a lot of challenges that they face. So thank you for shedding some light on that. Pam, I'm curious, talking about children and families, they obviously, the population that your department serves have many barriers to nutrition. I know you brought up a number of those. Could you talk more about the long-term health impacts that children have when they experience food insecurity and or poor nutrition?
I can, but before I do that, let me just follow up on Karrisa's comments, because I think there's something really important here that Karrisa and I know, because it happens all the time. Many of our families are the same, because over the last 5 to 10 years, as affordable housing has got less, as people have struggled, families have moved in together. So you will have grandparents and great-grandparents with parents and children, sometimes 3 or 4 generations in one household that is not doing well. And so it almost multiplies the issues. And Karrissa's staff and my staff are constantly trying to figure out the many different issues that will be in one household where there is very little income coming through the door, and everyone is trying to manage what they have. And so I think we see that now, and we will see that more going into the future. And I can talk about that later. But in terms of long-term health outcomes, I mean, you sow the seeds of your health right when you're young. That's when we build our body for the future. And so for children who are not getting the right level of nutrition, because frankly, proteins and other nutritional foods are more expensive and less accessible, then all of the things you need to go into adulthood, a strong bone system, a good immune system. I'm not a doctor, so, you know, Nilesh could talk about this a lot better, but this is where the early start of things like high blood pressure, poor immunity, and all of the other building blocks start to happen. And there's a real connection between life expectancy and what we call the social determinants of health, food being just one of those. I mean, it is no coincidence that in one of our poorest neighborhoods, Brooklyn Park, they have a 15-year less life expectancy than someone who is living my life. I don't live in Arnold, but who is living and has lived a comfortable life with good access to food, recreation, and so on. So think of it as building blocks for children. The 0 to 5 particularly, going on upwards, if we're not building the right structure and including brain power for a child, then you start looking at lack of success and all of the things that follow from that. So yes, it's you can really predict, unless there are some interventions, you can predict what's going to happen.
Thank you, Pam. Nilesh, anything you'd like to add to that point, just about long-term health impacts or else other accessibility challenges to adequate nutrition that haven't already been highlighted?
Yeah, I just want to build on that. You know, we did a food assessment in the Brooklyn Park community. I think it's about 4 or 5 years ago now. And some of the things that came up as like the big issues that families were having were things like family preference. So cost and transportation were the biggest ones, but family preference, prep time, don't like the taste of healthy food. These are issues that we may not pay as much attention to, but if we think back to comfort foods, the things that we were primed on when we were growing up, those are the foods we tend to have a taste, a preference for. And so, you know, we dismiss that at our peril, right? If we can build in those, not just the availability, but also the ability to make foods that are flavorful, that people prefer in kids at a younger age, we're going to see those benefits over the course of an entire lifetime. You know, Pam mentioned that the life expectancy gaps that we see in the county, those start very young. We spend a lot of time trying to make up for lost time with adults, with older adults. But I think if we target a lot of our efforts to the youngest set, to families, to new families, that's where we're going to see our biggest gains over the long term.
Great, thank you for adding that. And I'm looking forward to later in the discussion hearing maybe if the health department has some initiatives that have specifically targeted the comment that you just made. There was a question that came in the chat box that I think is pretty timely to this particular discussion that we're having. So I know I could weigh in a little bit, but Pam, please also jump in. The question was about how are we supporting school-age children for food accessibility on the weekends, especially those that are receiving their meals through the school. That's primarily the way they're getting their meals during the week. Our organization does have a Backpack Buddies program, and we provide healthy snacks. I believe it's 4 snacks and some other items that they can take home with them over the weekend to kind of help to tie them over and fill that gap. Before the pandemic, we had a rather robust program. When the schools went virtual, we obviously had to pause that program. So we are getting it back off the ground. I know we have at least a few thousand students who are receiving those meals, and we have partnerships with a few different county-based schools. So great question there, Pam. Any other initiatives, I guess, that you're aware of as to how we're supporting school-age children for the food accessibility on the weekends?
So let me start by saying our school system does a magnificent job around feeding children, and they feed everybody and did feed everybody during the pandemic. Obviously, weekends get much more difficult because the school system closes. So what has tended to happen over time is that things like the backpack programs happen in all sorts of agencies. The food bank used to do a really robust one, but there are others done by other not-for-profits throughout the county. Is it enough? Absolutely not. We have children who are okay during the week and hungry at weekends because we have no consistent weekend program. We have programs attached to schools. We have backpack buddies. I see Dr. Ashworth on here. Dr. Ashworth does some marvelous programs around food. We have our pantries, we have our pop-up pantries, but there really isn't a consistent notion of how we ensure that children are fed nutritionally 7 days a week. So I will say that, and that's not to say that all the volunteers out there are doing some fantastic work of filling that school system gap, because that's what it is for school-age children. It's an actual gap of 2 days. And then when we run into the summer holidays, we start seeing bigger gaps. Again, the school system has stepped up. I am sure you all know Jodie Reese. It's like having the most incredible food dynamo you could ever possibly have. She runs all the food for the school system. She has developed everything she could on a slim budget, including mobile meals to children. But even given that, we leave it systematically to our school system, and it is a 5-day-a-week system. And that has always seemed odd to me, that children are coming in on Monday morning not prepared for school because we don't know what they ate over the weekend. That's obviously a huge issue.
Great, thank you, Pam, for chiming in. And just a correction with our program, it's 4 meals and some snacks. So we are trying to build that program back up, and to Pam's point, there are a number of other efforts across the county, but it's really important that we fill that gap over the weekend, because as Pam alluded to, they're coming back to school on Monday and having a challenging time getting back into learning. So thank you. I want to pivot. I feel like that's the COVID word, to talk about COVID-19 and how the pandemic has impacted nutrition and food insecurity. So obviously it's been a part of our lives for the last 2 years, and I think we're all, it's safe to say we're all sick of it and wish it would go away, but we know it's here for some time. And for us personally here at the Anne Arundel County Food Bank, it's impacted our operations tremendously, just in terms of the amount of food that we are giving out. Food assistance at our pantry partner sites increased 5-fold in the last fiscal year, from 5,000 to 34,000 households being served each month. How we acquired the food that we distribute changed. We were traditionally receiving donations from community members for the food that we ended up distributing. And with the pandemic halting a lot of the food drives that we were used to receiving the donations from, and also supply chain issues, we were going to have to rethink what we did in terms of purchasing food. And fortunately, we have been able to receive a tremendous amount of financial support by way of the county, who's getting federal funding to be able to purchase food. So that gave us more flexibility in terms of what we purchased. And we really focused in on purchasing healthy food items. Over 1.7 million pounds of food that we distributed last year was fresh produce. So that's a huge priority for us. And hopefully as we move forward, we will continue to have that flexibility, and also keeping in mind cultural preference. And there are large pockets within our county of Latinx population. And with that, trying to keep in mind some of the preferences that they have shared at the pantry sites they frequent. So those are just some of the things that have impacted our operations. But I'd like to turn it to our panelists and start with you, Nilesh. Can you talk about how the pandemic has impacted food insecurity and nutrition in our county?
Sure. So, one of the things that COVID did quite clearly was highlight the faults that existed in society, highlighted the inequities and disparities that exist. So we've seen that during this time, right, folks have struggled with housing, with employment, but also with access to food, and that goes in with income, and largely, the past couple of years, that's income related. We've seen in our county from 9% to 10.7% of people experiencing food insecurity specifically, and voicing that. So that's over somewhere around 65,000 people. I think it's important to recognize that that's not evenly spread out throughout our community, right? People who are Hispanic have higher rates of food insecurity, close to 20%, close to 25% for Blacks. And so there are disparities with that. And I think that one of the things that we've really focused on, there's been a lot of efforts to stand up additional food pantries, do additional food services. I remember particularly in 2020, there was a lot of effort on that front, both from the schools when we're talking about kids to various community programs. And I think that the key here is to understand what was needed and what's going to continue to be needed. I think one of the biggest concerns I have is the sense that as COVID becomes endemic, it's not going to go away. It's just going to be a baseline part of what we do, that somehow the need has disappeared, right? And that's not going to be the case. The need hasn't disappeared. In fact, there's a lot of ripple effects from COVID in families that have lost loved ones. I just saw some data that nationally over 5 million children have lost a parent or a guardian due to COVID. That's a massive, massive impact on families, right? And just to be very, very pointed, that's the loss typically of a wage earner and food security, and that leads to food insecurity. Aside from all the other issues that brings into children's life, losing a parent, losing that love, having mental health issues, the whole gamut. And so we're going to be dealing with the consequence of this, but it's going to fall disproportionately on those with lower means. And so, that's why I come back to that question of, are we going to keep the spotlight on this and keep up our pressure to address these issues?
Well, just as a follow-up question, are there initiatives that the health department has undertaken to keep a spotlight on this issue? And in addition to that, just continuing to support the increased need for food?
Yeah, I think there's a few things. We work really closely with both Pam and Karrisa, but particularly Pam, because she's in the process of doing a community health needs assessment right now, and food insecurity is one of the key pieces of that, and that's going to definitely be something that we're going to be highlighting. Our Healthy Anne Arundel, which is our Community Health Improvement Coalition, one of the two areas that it's focusing on is healthy eating and active living. And that's based on what the community said is their health priorities. The other one is mental health. And so there's a real focus of effort on identifying what the gaps are and addressing those. And then we operate a healthy food pantry in Brooklyn Park, but we're looking to do that same food assessment that I mentioned from about 5 years ago in Brooklyn Park, looking to do that in South County. There have been services that have come up during COVID. Our goal is to try to understand what the ongoing service needs are and how best they can be filled on the longer term. South County has just a very different transportation, resource, density, flavor than the rest of the county. And so it's going to need different types of solutions and partners to be able to address that. And that's just a few of the areas that we're working on to address this.
Great, thank you for sharing that. Before I turn that question to you, Pam, I just wanted to, I'm scrolling back in the chat box. One of the participants mentioned something about farmers markets and also how right now it appears that, and maybe if someone can confirm this, are there only really 6 farmers markets in the county, 2 of which accept SNAP. So if that's the Supplemental Nutrition Assistance Program, benefits food stamps for anyone not familiar with that term. And only 1 is located in a food desert. And I'm kind of trying to determine, 1, is that true? Do we have any initiatives to expand the number of farmers markets, and especially those that accept SNAP benefits, in particular those in the food desert areas. And I know that's quite a big question, but if someone is able to speak to that, I'm really curious to hear more.
I can speak to that, Leah, but first of all, I don't want to denigrate social services and eligibility programs. I know somebody put in the chat there's loads of programs to help people, and there is SNAP, there is WIC, which comes out of Nilesh's health department, but they are eligibility programs and not everyone is eligible. So there is a gap between things like SNAP and WIC and families and what they need to earn in this county in order to be able to put food on the table. There's a real gap. So in terms of farmers markets, that is difficult to assess at the moment. It was getting a lot better. In fact, Nilesh's staff and Jody Reese really worked to talk to farmers markets and farmers about accepting SNAP, and they did a really good job of it. Now, just like everything else with the pandemic, farmers markets took some damage because obviously people were not going out to farmers markets. I think that there was a fantastic one in Brooklyn Park that was a coalition between the health department and the school system and us. And we did healthy food and all sorts of things that are in line with Nilesh's healthy pantry in Brooklyn Park. I don't know whether that one is coming back or not. So I think that the jury's still out on where we are with farmers markets, but they really did take a hit. In terms of the partnership's response to the pandemic, it's sort of interesting to be with Nilesh and Karrisa on this discussion, because obviously they come from very large agencies, and large agencies, it's much more difficult to respond very quickly. For me, I've got 30 staff. We can turn on a dime. So at the beginning of the pandemic, we sort of said, what on earth should we do? What is the best thing for the partnership to do? What is going to be the thing we can get our hands around quickly? And what are people going to need quickly? And so we decided it was food. We already had an excellent relationship with both our food bank and the Maryland Food Bank. We were already doing pantries on the go, which are our pop-up pantries in around 5 locations in our communities of hope, which are our areas of most need and least resources and most social determinants. So we were sort of already in the business a little bit. And because of that, we thought we could just pinch hit while the county was turning around their services to also do food. So in the first month, we worked with our food bank and with the Department of Aging and with others to start setting up pantries. And I just remember our shock and horror at how many we needed and how many people turned up. It was astonishing. I remember there were lines of like 1,500 people. We had to have my staff doing traffic. It was incredible. So I think we evolved, and after a month, the county got on board, we all got on board, we figured it out. Everybody did a fantastic job. And we have literally, us in the school system, we have served millions and millions of meals. I mean, all of the volunteers, I know there are people on this Zoom call that have been part of it. What a fantastic, coordinated, collaborative initiative. From government, from not-for-profits, from the faith community, from business. We had Feed Anne Arundel making meals. They brought all the employees back to work to make the meals. That we look back on those times and say, why can't it always be like that? It should be like that every day. We should be approaching our work like that every day. Because the truth is, Mary Spencer, I've just seen Mary Spencer over there. We were all part of it. We are all people who know one another, work together, know the areas we need to be, and know how to feed people. We were worried that there wasn't enough nutritious food in the pantries, and that's, another bigger topic. And so AACDS gave the partnership money so that we could come behind the pantries with nutrition, with chicken, with vegetables. We bought stuff wholesale from farmers. I mean, it was a fantastic effort. And you look at the numbers over that 18 months, it is quite unbelievable. Unfortunately, and Nilesh is spot on the money, and I am so worried about this, there is this notion from the federal government all the way down to the local level that somehow it's all over and that level of effort does not need to continue. So I will tell you that the people who could recover the least quickly or take the longest to recover are the children and families and seniors that Karrisa and I and Nilesh serve. They are the ones who are least likely to recover quickly, the ones who have built up debts, even though there were lots of federal programs, who were trying to figure out what not to pay. And if you've never been in that circumstance of what not to pay, you are a very lucky person. I understand exactly how you look at everything and think, what am I not going to pay? And what can I build up for 3 months and no one's going to come and get me? And we have got hundreds of thousands of families in this county who have done that over the last 2 years. If you do not believe that, you are a very, very lucky person if you don't think that that has happened to our families. And frankly, it has happened disproportionately. It has happened more likely to African-American families and Hispanic families. And I could write a book about that. So this notion that, you know, all the money's going away from the food pantries, guys, you better get ready for this. We have just asked our county not to do that, to make sure that there's money for pantries. The federal government are doing cutbacks. That is coming, and that is a cliff, and that's not a good way to come out of a pandemic. There should be a slow reduction in all of these benefits. Otherwise, we're going to create a mess. We're going to have people, we've already got our eviction prevention money going out the door. We don't want to push people into those sort of choices where we end up making people homeless. So in your capacity in the community, if you could talk that up, I would really appreciate that, because that's going to be a hard fight for us. Nobody wants to continue those programs because they cost a lot of money. I will tell you that the consequences of not doing that, it's going to cost us a load more in terms of health, in terms of school performance, and all of the other things that go along with food. And now I'll shut up. I'll get off my phone. Thank you, Leah.
That was great, and there were the wheels were turning in my head on so many things that you were saying. Just to comment on what you were talking about just now with the reduction in federal and possibly state and local government funding for food and other necessities. I am aware that Maryland Hunger Solutions is doing a lot of advocacy work and awareness around some of these waiver extensions and continuing them on for both the WIC and the SNAP, as well as the free meals that students have been able to receive in the schools. And so that is something that I know, you know, for our organization, while we might not be able, because of the nature of our work and what we're focused on, to get so involved in the advocacy component, we are very much prioritizing raising awareness about those issues. And if there's the opportunity to sign on to those letters or be in the room with some of our elected officials to share why it is important that those continue, that's just something we're doing. And I know that we have so many advocates on the call who are doing some of that same work. And if you're not, hopefully this inspires you to raise awareness. And if I could also add to your point, Pam, earlier, to the comment about SNAP and WIC benefits and who's eligible and who isn't, one of the things that hopefully I'm regurgitating this correctly, if a family of 4 makes like $50,000, they're over the threshold and not eligible. And $50,000 doesn't take you very far these days. So, I mean, it's a very low threshold. And I think there was also just a comment, to that effect in the chat box. So, thank you for shining a spotlight on how that does not address all of the members in our community's needs. And, our organization will continue to ensure that there is food available to people so they don't have to make the decision between whether to pay the rent or buy food, that they can access that food for free. Karrisa, I would just love to know a little bit more from you about how your organization, how your agency, I should say, has responded to the pandemic and that increased needs, what you're doing to address food insecurity.
Sure, and before I do that, I'd like to add on to what Pam was saying. For families that have to figure out what not to pay, in a given month is often times how our case managers have to work with individuals when we have very specific grants that fund very specific things. And oftentimes it's putting the puzzle together of a plethora of resources just to get the need covered for the family. So if I can handle your food for this month, or if I can pay that BG&E bill, are you able to get back, to and from work? Are you able to come up with that first month deposit so that you can be housing secure? So that's, it mirrors exactly how we all puzzle together resources. And I want to say during the pandemic, especially with, who my fellow panelists are, we started talking, we came together. I think that made a huge difference on how fast this county was able to pivot and provide resources that were much needed in the community. I spent many Saturdays with, the Department of Health and the partnership, all day, all night, trying to figure out how best to serve this community. So I'm proud at how unsiloed we've become. As far as our response for aging and disabilities to the pandemic, again, this was a countywide effort. We were lifted by our nonprofits, by our clergy, by Central Services, Office of Law, Health Department. I mean, the response to supporting this community was across all of county government. We had to quickly pivot out of 20 congregate nutrition sites that we have within the county and move towards outdoor food distribution and food delivery. So during this time, we served 150% more meals. People that were under-resourced, underserved, that we had not even met or understood that we provided this service, came to need our support during the pandemic. So I think that it was even over 500,000 meals, and then that was an all-county effort. We also had the opportunity to help those local struggling businesses through restaurant initiative grants that we were given for mom and pops. It was a win-win situation in that we were able to procure diverse meal options from those local businesses to keep them alive, and also feed older adults, individuals, and all community members, really. We worked with nonprofits to do grocery delivery. I even remember doing FaceTime with an older adult at Giant, showing them the shelves and what was left to try to get the right and most healthy food combination. And I want to also thank the Anne Arundel County Food Bank. We had a huge partnership. We put on every Friday, Fresh Food Friday, where we distributed over 28,000 boxes of fresh produce to the community members. And that was something that I look forward to every week. And then my predecessor, Pamela Jordan, former director, had established her vision of the Food Access Warm Line, which quickly evolved into the Vaccination Warm Line and the Everything Warm Line. But that was the 222 food. And really, we provided food and any resources to all community members. And then finally, the Meals on the Go pop-up sites, reaching our different cultures within our community to make sure that they had food access, a food that was important to them and familiar to them. And I think I covered it all.
Great. Just a few things. It's just such an impressive list. And, one of the reasons we asked each of you is because of the partnerships, the strong partnerships that our organization has built and sustained with each of your groups. I mean, it truly does take a village. And we're so grateful to be able to partner with your groups to make sure that our county residents have access to food. I'm glad you were able to highlight the Fresh Food Fridays. I mean, that was such a phenomenal partnership, and awesome to just hear that stat of 28,000 fresh food boxes went out. And I just thank you again to each of you. We're kind of at the point in time where we're going to take some questions, and I did see a few things come into the chat box. So I'm trying to go back and do my best to answer some of these questions. There was a question about, are there ARPA funds, federal fundings for food access? Our organization is currently receiving some ARPA funding, and that has allowed us to purchase food, upwards of $1 million worth of food to be able to distribute to our community members. So we're very grateful to have access to that funding, and hopefully at least into next year, and as we continue to see that increased need. I did see, it looks like there was someone is saying something about food distribution, being told to collect statistics from recipients, and that has adversely affected the efficiency of the distribution, asking for such personal information. I know that during the height of the pandemic, our food pantry partners, we were working with them to kind of eliminate some of these barriers, as well as just speed up the process, like how quickly someone could get in and out. So we weren't asking for some of that information. I know that we are required for federal purposes with some of the funding we're receiving now to document certain pieces of information, but oftentimes it's self-reported. We're not actually collecting documentation, or our partners are not either. So I hope that speaks to that point. Karrisa, this might be a question for you. There's a comment about someone saying they have data that shows that there will be an explosion of poor seniors in the coming 5 to 20 years. The number of poor people over 70 needs to be planned for. Can you, I don't know if that's something that you're able to comment on, if that's a stat you're familiar with?
The best statistic that we have on that, the Maryland State Department of Aging has their master plan, and you can see the population growth right in there as far as the projections. There's a few different partners that have.
We're getting a little. I'm sorry to interrupt you. We're getting a little feedback. I just hopefully, if everyone is not on mute, make sure you are putting yourself on mute. So, and I'm sorry to interrupt you. If you want to, you said Maryland Department of Aging has.
The Maryland Department of Aging has that statistic of projection by county in their state plan. We're serving the fastest growing population, not only in this county, but nationally. Looking at my funding, it comes from the Older Americans Act of 1965, across different titles, of which I get grants. Funding over the years. So we've definitely brought it to the attention of our state counterparts that with this population growth, our grants are going to have to increase to mirror the need in the community.
Thank you. And we are still having a little feedback. I'm sorry on your end. Hopefully everyone was able to hear that, but if not, we'll definitely make sure to get a little bit more information from Karrisa and email that out to folks. There was a question from someone about, do we have a community garden in Anne Arundel County? Fresh produce free, plus a sense of community for residents, and of course the composting area. Is anyone able to chime in about that? Thanks, Pam.
Yes, so we have some community gardens, but we have no system for creating community gardens. South County did a nice job in some areas. The problem with community gardens is you've got to get buy-in from the community itself, because they've got to be maintained and looked after. So it's really better, I think, if they grow up from inside the community. There's a cracking community garden at Woodside Gardens, and they grow all sorts of vegetables right in the middle of public housing. And it's one of my favorite ones because it is actually looked after by the people who live there. And I think they are the ones that tend to survive and do well because there's real buy-in. There are other ways to do it, but it takes a real municipal effort that we have not seen. in our county. I know that the health department and I have talked many times about community gardens and have set some up. I think Anne Arundel is on here, but it always comes down to, how are you going to maintain the community garden? Are you going to get the community's buy-in to do it? It's a wonderful idea, and especially for children, because they learn not just to grow vegetables, but to eat them. And so it's a wonderful idea. And it's interesting because there was a young teacher up in North County High who built a community garden in his classroom and a greenhouse with some of the most, what we would think of as challenging children. And it was one of the best things I have ever seen. That he grew things all over the place, and the children were making salad dressing. And then in the end, they actually started a little grassroots project to sell the salad dressing. They were eating vegetables for the first time. It was terrific. I don't know whether he's still around, but one of the best things I've ever seen in terms of really bringing young people into almost like an entrepreneurial approach to healthy food. So I would say, this is a long answer, but I would say it's happening in pockets, but there's no overall plan. And it's a really hard thing to do unless you've got a lot of money. The Real Brooklyn has done a fantastic job of it, by the way, if you've been in Brooklyn recently. While I have it, and because we're going to finish, I just want to say, for those of you who don't know, our food bank, Anne Arundel County Food Bank, was magnificent during the pandemic. They had to change their operations so quickly to meet this massively increased demand. And I don't know, I honestly don't know how they did it. I don't even know how Susan's still alive, because I think that they work 24 hours a day, and they are such wonderful partners. But if you wanted to see a group step up, they stepped up. And I think that's why so many people in our community, so many volunteers stepped up, because they saw such excellent examples of people really coming right out of their comfort zone and working 24 hours a day and just doing it. I mean, it was, so thank you, Anne Arundel County Food Bank. You did a fabulous job, and you still do.
Well, thank you, Pam, for that recognition. And I know we've got Susan's listening in, so she and this is recorded, so she definitely has that. She can listen to it on repeat. And a few other team members who were here, blood, sweat, and tears, really making the wheels turn. And I think they did actually work 24 hours a day, and supported by a number of really phenomenal volunteer members from a few different groups who came in and helped support the operation. So very grateful for the federal funding we have available now, so that we can have paid staff members here in the building to support our warehouse efforts, because that is such a huge undertaking, and it's made operations much more efficient. But thank you so much for that. So we just have about 2 more minutes. I'm not sure if Nilesh and Karrisa, any final remarks from you that you'd like to add before we sign off?
Yeah, no, well, one, want to thank you for your partnership, Leah, and for the food bank. Somebody mentioned healthy pantries. The Brooklyn Park Pantry is a healthy food pantry, actually. And one of the keys is your partnership in making sure there's proteins and fruits and fresh dairy, all those things that are really critical, right, to families. It's not, somebody mentioned, it's not just canned beans and canned green beans. It's that plus many, many other things. The other thing is, I just want to make a little pitch for the Healthy Eating and Active Living group for Healthy Anne Arundel. I would love for anybody who's interested, we put the website in the chat. Please join us. We have monthly meetings. It's an opportunity to bring folks together to address some of the issues that you've brought up, whether it's what's the food in the pantries, where can we do community gardens. Pam's right, there isn't an organizing body for each of these things, but if we can serve some sort of catalytic or organizational perspective, that's why we're putting our muscle behind this. Healthy Anne Arundel is a consortium of a wide range of healthcare, social services, economic, faith-based organization, community-based organizations. So there's muscle there, and I'd love to see this energy continue. So thank you to everybody, and thank you, Leah.
Okay, thank you, Nilesh. Any final remarks from you, Karrisa?
I be heard, am I still muffled or?
Oh, you are. I'm so sorry. Oh no. If there's something, website you want to drop in the chat box or any information, please do. I apologize that we did not get a chance to answer everyone's questions, but it looks like the last couple of remarks are just, kudos to us and especially Susan, who really did a phenomenal job. So thank you to all for those remarks. And maybe if I could just add to the part about healthy foods, just in terms of what the Anne Arundel County Food Bank is doing. I did mention earlier that with the purchasing power we have now, we are being more thoughtful about those items and what we're purchasing, and putting emphasis on produce. For those that were on right at the beginning, talked a little bit about just the sheer volume of produce that is going out our door. So 1.7 million pounds of fresh produce in the last fiscal year. And fortunately, due to some funding that we had received prior to the pandemic, we were able to upgrade and expand our refrigeration capacity. So that has allowed us to store all of those items and then get them in out the door. So, just to add on to that and what we're doing to try to prioritize healthy eating and healthy living. Just a couple of closing remarks. Thank you again to our panelists. We really appreciate your time, your expertise, all of the hard work that you are doing, and your passion for improving the outcomes of residents throughout our county. Thank you to each and every one of you who tuned in for this hour. The great questions, your thoughtful and enthusiasm. We are just so very grateful to each of you. Melanie, my colleague, is going to drop a few links in the chat box, but we just wanted to let you know that on our website, we have some more food resources, and you can check that out. So log on to aafoodbank.org and you can check out food resources in our county, as well as how to get involved if you're interested in volunteering, hosting a food drive. Again, this is Nutrition Month. We have some really awesome events coming up. Melanie has just done such a phenomenal job coordinating with some of local groups and partners. Some of those events are on March 16th. We have Ask a Pediatrician About Nutrition. That's at 6:30. And we're going to throw the link in the chat. You can also see the link to sign up on our website too. We're teaming up with Nutrition Kids, which are kids from the Boys and Girls Club of Annapolis, as well as Anne Arundel County Public Schools, and they're going to help us spread information about nutrition and encourage us to eat healthy. And you can listen to them on WRNR, and they are sponsored by Himmel's Landscaping, and you will also see them featured in the Macaroni Kids Annapolis. So we've got more web information, different events listed on our website. A huge thanks to all of our sponsors and partners who made Nutrition Month possible. And also, if you're not registered to receive our e-newsletter communication, please consider signing up for our e-newsletter. Portia of Annapolis, they're actually donating $2 for each new sign up. So we're going to throw all of that, a lot of information. Check out our website. We are so grateful for your time and your attention, and we would not be able to continue our critical work without each and every one of you. So thank you so much. Wish you all a wonderful day.